All of your marketing efforts are designed to do one thing: get prospects to make an appointment. Now, most of these efforts are designed to get them to set an appointment even in a specific way, such as making a phone call into your office. So, as such, dentists pour a ton of effort and money into making your phone ring. And then what? How much effort are you putting in to make sure that that phone call converts into a new appointment and that that appointment then becomes a new patient? Talk more when we return. Colin here, and welcome to another Saturday edition of the Patient Attraction Podcast. And for the next 2 days, I want to give you the basics of successful phone technique. I'll remind you that from one of our podcasts over the summer with Dr. Howard Ferran, he said that poor phone technique is costing dentists more patience and money than anything else out there. I've talked about phone technique for dental offices many times before, but the information that I'm going to give you today is worth thousands of dollars. Today and tomorrow, I want to give you 10 tips for successfully turning those phone calls into paying patients. And I suggest you grab a pen and a notepad and write these down and share them with your staff. Talk about what you're going to do today to change the new patients coming into your office, to increase them. Now, first off, how many of your phone calls are greeted warm and professional? A great technique that I learned a long time ago was to say the practice's name, the answerer's name, and "I can help you." Affirmatively say, "I can help you," not say, "How can I help you?" Something like, "Thanks for calling Dr. Receiver's office. This is Colin. I can help you." This is even a technique that we implement ourselves here at SmartBox. It gives the person answering the phone the authority to help that person calling. Make sure before you answer the phone that you're 100% focused on the caller, because if you're not, it's going to be obvious very quickly. Second, ask for the caller's name. Greet them by name. "With whom am I speaking?" "Thanks, Sally. How can I help you today?" I once heard it said that there's no sweeter word in the English language than someone's own name. Continue to use the person's name naturally, even if you have to make a note and write it down for what it is. And third, remember to always direct and control the conversation. This means moving away from "how much does it cost" questions and "do you take my insurance" to "we can help you solve this problem." Don't get trapped in answering yes and no questions, because those are no-win questions for you. Fourth, ask questions that are directed to your caller's needs. If someone calls in and says they need an appointment, don't be afraid to ask for more information. The more information that you find out about your caller, the better you're going to be able to help them solve their problem. And finally for today, remember to restate the problem back to the caller. Now, this is just plain good communication technique in any walk of life. In taking the phone calls, this makes sure that the person taking the call actually understands and interprets the needs of the caller accurately and as the caller intended them and the needs they have. It also shows the caller that you've been listening to their problem, and they're going to appreciate that. These are the first 5 tips for a great phone call experience. Come back tomorrow. I want to look at the final 5. Until then, keep moving forward.